Hello and welcome to the Anxiety BC website and to this interview on anxiety. I'm Dr. Michael Catchpole and my guest is Dr. Michel Dugas. Dr. Dugas is a professor of psychology at Concordia University and also works at the Anxiety Disorders Clinic at Sacré-Cœur Hospital in Montreal. Dr. Dugas, thank you for being here.
Thanks for having me, Dr. Catchpole.
Dr. Dugas, people are probably coming to this website because they're having some difficulties with anxiety. Could you talk to us as a psychologist, what is anxiety?
Well, first of all, anxiety is our body's natural response to the perception of danger or a fearful event.
Okay, but this must go off inappropriately on occasion.
On occasion, it does. And that is because anxiety is the response to perceived danger. So in fact, if I'm faced with a situation that isn't actually dangerous, but I believe it to be dangerous, then I may react with anxiety. And that's a little bit like an alarm system that goes off, even if there's no actual danger.
Okay. Now, in a broad sense, for people who suffer from what they feel to be too much anxiety, what are some things they can do?
Yeah, the most important thing that someone can do to cope with anxiety is to remember that avoidance fuels anxiety. So that means that that individual will eventually, sooner or later, have to confront their fear. And we've known this for many years. It's easy to know, but it's much more difficult to do.
I'm sure it is. And then there must be a way you can sort of start easy and crank it up. Is that correct?
That's exactly right. So starting with small steps, confronting the anxiety, managing it, and then moving towards situations that are more and more difficult. And it's important to keep in mind that when we experience anxiety, when we're facing something difficult, that's actually a sign we're on the right track.
Okay, so one does have to be willing to put oneself in the situation.
Exactly.
And as one does that, the anxiety must get pretty high, and this is frightening to some people.
It can get quite high. But it's important to remember that anxiety is not dangerous, especially when one thinks about being very anxious in the short term. There is no evidence that there is any danger behind that. The other thing is that anxiety has a limit. So we begin to get anxious, it reaches a ceiling, and then gradually will begin to come down if we stay in the situation.
Very helpful. What else can one do?
Well, the other thing that changes when we're anxious is our way of thinking. And when we're faced with an anxiety-provoking situation, we tend to have thoughts that begin with what if? What if my plane crashes? What if I make a fool of myself? That kind of thing. And that very negative thinking tends to feed back and fuel the anxiety. It's important to keep in mind that that thinking is not always realistic. When we become anxious, we tend to overestimate the probability that bad things will happen. And we also tend to overestimate the cost should that thing actually happen.
Fair enough. Dr. Dugas, very helpful. Thank you.
My pleasure.
My guest has been Dr. Michel Dugas from Concordia University.